So there are a number of risks involved in having a hip replacement. The generic risks really are either the formation of a blood clot or an infection in the hip, and all patients undergoing surgery receive blood thinning medication and antibiotics as a way of minimising those risks, which therefore are kept down to 1% at most, if not less than that. There are some risks that are specific to hip replacement surgery, and these include an unequal leg length afterwards. Often patients have a short leg as a result of the arthritis before they start, and when that leg length is corrected, that can sometimes give the sensation of the leg being too long because the muscles are stretched out to a length they haven't been working at for a long time. There are some important nerves and blood vessels around the hip joint which theoretically can be damaged, although often it's possible to visualise those at the time of the surgery and make sure that injury doesn't take place. And then the final thing to say is that, especially in the early weeks after hip replacement, there is theoretically a risk of the hip dislocating, so the ball and the socket can come out of joints, and the surgical team and the physiotherapist often can be very helpful in providing guidance and advice for the patients in the period immediately after the operation in ways that they can minimise the risk of that happening.